People on the remote First Nation of Attawapiskat say the spate of suicide attempts started last October with the death of a 13-year-old girl. They say since then, dozens of the community's 1,800 people have attempted suicide, culminating in 11 attempts in one night last week. That overwhelmed Attawapiskat's 4 healthcare workers and forced the community's leaders to declare a state of emergency. Tonight, Attawapiskat's chief said the crisis is all-consuming.
It hasn't been easy to be strong. It hasn't been easy to stay positive because I keep thinking about our young people. And as a chief and as leaders here in our community, we don't want to lose any youth.
The state of emergency allows the chief to ask for extra help in dealing with the suicide crisis. Today, both the federal and provincial governments dispatched mental health crisis teams to the community.
We are putting in place a number of immediate measures to be able to address the problem. There are, as of today, there are 2 additional mental health workers from Health Canada who have been sent into the community.
I think that they want the immediate mental health supports, but they also know that this is a long-term tragedy that is being ongoing.
The Member of Parliament for the vast area of Northern Ontario that includes Attawapiskat said mental health in Aboriginal communities has been ignored for too long.
Why is it that it takes a state of emergency when we've had 700+ suicide attempts in the James Bay region in the last few years? Why does it take a state of emergency to get a plane load of healthcare workers into the community?
This is the 5th state of emergency Attawapiskat has declared in the past 10 years. Others were due to flooding, overcrowded housing, and poor drinking water. Ron Charles, CBC News, Toronto.